Greetings! First, I would like to greet everyone a happy day, especially to you, Ma'am Caroline Pahimola. And are you guys excited? Because we Group 4 of VSA Wani are super excited to share and to everyone regarding some insights about Baptist Health System or Medical Society rather. And before we dig in with some complex definition, complex reporting or otherwise, let's have a preview or a brief history regarding this business so that we will have some small details regarding the business before we start, okay? A history of compassionate care and service. You know, the Baptist Health System started began in 1903 with 30 physician members of Bexar County Medical Society joining more than 2,000 business people and professionals to organize the San Antonio Associated Charities. As the community grows, so did the need of healthcare services. Over 100 years, Baptist Health System includes acute care hospital, urgent care clinics, imaging centers, and freestanding emergency departments. The commitments of the business remain the same over the years to help people achieve health for life through compassionate service inspired by faith. The business always says that when we look back, we're proud of our facilities and improvements that enable us to serve patients and families with excellence. Guys, excellence. They serve their customers with excellence. You know, they have this history of seeking ways to improve care and creates a list of first in healthcare in San Antonio area. And do you know that they have this first eye bank in San Antonio to procure tissues of corneal transplant surgery? First patient or customer representative program in San Antonio. They also have this first coronary care facility dedicated to care for heart patients in San Antonio as well. And they have this first social service department to assist patients and their families, and also CT scans in Texas. And you have also this first percutaneous removal of kidney stones in San Antonio. They also have this first hospital in San Antonio with technological to repair stones retinas. You know, and they also have this first hospital in Texas with research and treatments of glaucoma with therapeutic ultrasound. This company, this medicine business, they have a lot of firsts. Take note, they have a lot of firsts, and just try to imagine how excellent this business is. So, we Group 4, we would like to discuss to you what are their techniques, what are the key, what are their keys and how to make this business this passionate, this excellent as possible. So, Mom, classmates, we are Group 4 and we were going to discuss to you more about this business.
I will be discussing about the previous problems that the Baptist Hospital Incorporated encountered and how they address these problems in line with their performance excellence and organizational behavior. So one of the problems about this Baptist Hospital Incorporated, and it became a trend before. In mid-1990s, low satisfaction marks, not only from patients and their families but also from staffs and doctors within the organization. So the leader of the BHI decided that just improving was not enough. And with their vision of the best health system in America, the BHI leaders decided to rebuild their organization by engaging its staff in listening to its patients, and one of their first actions was to create a flat, fluid, and open leadership system based on communication, as we have all known that the key process for any team attempting to improve quality is an effective communication between the people within the organization and under their system that they have implemented. The staff are not just encouraged, they are also expected to contact anyone in organization, including the president down to the lower management, at any time to discuss work issues and improvement opportunities. Second one is that no secrets environment. Senior leaders also serve as a role models, and they are personally engaged in environment through activities such as the daily lineup in which all leaders and employees gather at each shift to review information in the Baptist daily and quarterly round in the CLAC employee forums. Third one is a multi-faceted systematic approach to building customer relationships that begins with BHI's standard of performance in areas such as attitude, appearance, safety, and even elevator etiquette. Senior leaders also serve as role models are held accountable for a health organizational performance through a no excuses policy in which the assigned tasks or works within the organization should fulfill with no other reasons to attain it. Because as part of the organization, they are obligated and committed to work with all their efforts exerted in every operations they have, and they can also make an additional in aiming performance excellence. Lastly, the company's infrastructure includes the multidisciplinary committees in leadership groups. This involves employees from all rights categories and provide standardized processes and forms within the network. Next is BHI uses a variety of tools and processes to gather results and information and data that can lead to improvements. First one is CARE. Stands for Clinical Accountability Report of Excellence, and it captures clinical quality data, results, and tracks more than 50 departments throughout the hospital. Second one is a BHI also makes an extensive use of information technology to gather and pass on information. Hospital information systems helps BHI to collect and integrate data for tracking overall organizational performance as well as financial, clinical, and operational data information and identifying opportunities for improvement. Lastly, they have developed a comprehensive set of policies.
Implementation of the tools and techniques used for performance excellence. Their performance improvement is a fundamental course, is a comprehensive curriculum based on Lean and Six Sigma principles. The organization enlisted members of its frontline staff by engaging them in its Value Care initiative. To provide educational experience, team members learn and use PIF method. Teach team members how to identify ways and apply problem-solving tools to improve how their department does business, apply everything that is learned by completing one project by the end of the course. Evidence-based care. Baptist Health Hospitals follow best practice guidelines where they exist as appropriate for the care and treatment of the patient. Standardized process improvement. This method includes Six Sigma Lean and change management. Introduce positive change with a higher degree of accuracy than relying on hunches or guesswork. So, in order to best support patients safely, Baptist Healthcare utilized several process improvement methods known as collectively as a process excellence, so they use this as a method.
Epic uniform sets. So Baptist Health medical staff work closely with Epic to create this order set. By using this order set, patient can feel confident that their treatment is providing current and consistent treatment. They look ahead that they should be the patient's choice in the market area and in the healthcare industry. Leader in values-based recruitment, employee satisfaction, employees retention, and leadership development. They ensure the satisfaction of the organization's skilled employees to take the appropriate steps to retain them. Also, balancing the resource requirements of the customer segments. An uncompromising commitment to patient safety across locations. They treat everyone how they would like to be treated, every time at every Baptist Health location. They provide compassionate care and service to all customers at the level which continues to set the highest standards in the healthcare industry. Each year, they sustain the position as industry leader in patient satisfaction. Also, they are committed in sharing its knowledge with other healthcare providers, and they continue to move high customer satisfaction to customer loyalty.
Let me present to you the results after the implementation of tools and techniques for performance excellence in Baptist Hospital Incorporation. The Bright Ideas program enabled them to have the number of ideas given by employees increased by 485%, implementing a total of 135% of these ideas from 2001 to 2003 exceeding their goals. Another one is the Clinical Accountability Report of Excellence, which enabled them to monitor and reduce the events of medication errors from 2.5 per 10,000 doses in 2000 to only 1.5 events per 10,000 doses in 2002. The extensive and effective use of information technology, establishing the Hospital Information System and the Medical Information Data Access System for physicians, earned them the Most Wired Award. Since 1998, the Press Gani has shown them to be at the 99th percentile for overall satisfaction for both inpatients and outpatients and earned almost 99% satisfaction rating for their staff, facilities, and services. They also became an employer of choice as they instilled empowerment and development programs, earning them their ranking. Observed from 1997 to 2003, the employee turnover rate reduced 17.1%, and from 1996 to 2001, the positive morale surrounding it increased by 37%. They continuously provide superior service based on Christian values to improve the quality of life for people and communities they serve, with people, service, quality, financial, and growth as its pillars. For a percentage on their total revenue, they provided the poor and uninsured treatment and prescriptions and established Women's Heart Advantage program to improve women's awareness, education, access to testing, and treatment in terms of heart diseases.